Thank you for watching this video. So what you're about to witness is how we engage with one of our physical therapists, or how we mentor one of our physical therapists through a particular case study. So the first section, we essentially have given you little fragments of the assessment video process. And then the second section is us problem solving with Dr. Brett about treatment planning and problem solving with a totally separate case. So I don't want you to think that the treatment planning case is us discussing about what we saw in the assessment section. So this is basically just a sneak peek of how we're engaging virtually. Because one other thing I want to just throw out there is we're still trying to figure out the audio. So my apologies if the audio isn't the best. All right, thank you for watching and enjoy the video.
This guy's actually a PT student that we're going to eval, and he's got some right hip pain, right lower back pain, some sciatica type symptoms going on, so we might use a little bigger language because he is a PT student. So don't yell at me for using big words.
Pull tight.
So we're going to do like an active straight leg raise. Okay. So tighten both quads up, dorsally flex both feet. Notice you bring this leg actively up as high as you can.
Okay, you can even just see right off the bat, joint, if that's the joint line, oops, of the knee. We're going to use just some FMS landmarks here. We know that he's barely a 1. 50 degrees, if that. Okay.
Okay. And relax and let me do it this time. Foot up.
Okay, still limited.
And then, so for someone like this, what would you do for like spinal flexion type stuff too, to get that thing moving?
From a telehealth standpoint?
I guess from both standpoints, because this is something I've been like wrestling with too. Is like a couple people I've seen, like it's like, okay, like we have a spinal flexion, a mobility issue. What are your kind of go-tos there?
So I'm in the very beginning with something like that. Like this guy, how old is he?
He's in his late 30s.
Okay, so that stiffness has probably been around for a while, right? So I initially start with, I like doing like the good old-fashioned take a lacrosse ball, lay on it on the paraspinals, teach him how to tense his paraspinals into the ball, and then relax, to teach tension, relaxation, contract, relax, so that he actually appreciates how to relax the tissue around the spine or around the area that we're trying to move. To me, that's step 1.
So you're gonna have him contract, relax on it?
Yeah. So basically, the way I would coach it is, okay, I'm gonna have to take this lacrosse ball, put it at like the TL junction, right on the paraspinals, and I'm gonna have him say, all right, I want you to actually contract your spine or your muscles there, so that you're pushing the ball out of your back.
Okay.
And then take a deep breath and imagine your paraspinals is like quicksand. I want you to totally relax and let that ball absorb into your body.
Yeah.
Like you're engulfing the ball.
So are we still trying to essentially have him gap the T-spine just to get him to relax first?
No, we're just teaching him here we're teaching him awareness of how to relax the paraspinals.
Okay.
It's essentially a self-care technique for a contract relax method.
I gotcha.
That makes sense?
Yeah.
And you're using visualization with your cueing, and you're using tactile feedback from the lacrosse ball, or a softball, or whatever he's got, a cane. It doesn't matter. You just need that tactile input. Okay, that's step 1. Once he can start to appreciate, okay, because at first he probably will struggle with even tensing that area and relaxing that area. Once he gains an appreciation for how to relax that area, now we can teach him how to move while being relaxed in that area. Because these people who have been stiff for a long time, they don't really know this, but there's this subconscious protective tone all through that area. And there's no way we're ever going to get to the joint if tone is always in our way.
Yeah.
So that's step one. Step two, now we can start using any type of segmental flexion cueing, right? Starting with unloaded positions. So the best tactile cue is the floor. So if he's laying hook lying or hook lying or completely supine, right? And then giving him some type of tactile stimulus to the area that you want him to flex in. So what I found very helpful is to take a TheraBand or any type of band, place it at the segment that we want him to move at, okay? And then pull on that band and then cue him, okay, I want you to push that area of your back that you feel the band under, push into the band so that I can't pull the band out from underneath. And he can be doing this to himself, right? Or he can anchor the band somewhere.
So I've been a student here for about 5 months now, and I have nothing but good things or great things to say about my experience here. So I've definitely been able to be way more successful as a PT with my patients that I'm treating. Thanks to this mentorship, there's a lot of things that have recently come in my door that I could have gotten better, but I wouldn't have been able to get as better as I have been with all the new things I've learned about movement and assessing, and there's so many little pieces to that Ramez is so good at helping and teaching with that are the key linchpins to the puzzle that I wasn't able to identify before, that has been the difference maker in getting someone to 80% better to 90 or 100% better, and having them be pain-free and having them know exactly what they need to do to keep themselves in that state of being healthy, for sure.